Hi, this is Caitlin Carroll here with Baby Pillow to show you what to do in case of an obstructed airway emergency. So as you approach the scene and realize that it's an emergency, you're going to first check for your own safety, and you're going to then check for any signs or clues as to what may have happened to your victim. When you approach the infant, after you realize that the scene is safe, you're going to ask for consent to treat and care for the infant from the parents or guardians nearby. Once you've gained that consent, you're going to check for signs of life by tapping the foot of the baby. If no signs of life are detected, you either call 911 yourself or get somebody else to do so. If you must leave to call 911, give 2 minutes of care first to the infant. Okay, so we're going to assume that we have called and an AED is on its way, as well as professional help. So we are going to start with chest compressions. We're going to use 2 fingers on the chest of the baby. We're going to get in position, elbows locked, shoulders over our elbows, and this hand is going to go on the forehead of the child, or the baby, I mean. We're going to do 1.5 inches deep compressions, 30 of those. So let's say we did those 30 compressions. I'll give you 3 of them to see what they should look like. So 1 and 2 and 3. So we do 30 of those. Then we are going to have 2 rescue breaths where we will gently tilt the chin and head back, or chin up and head back. Our mouth should cover the baby's mouth and nose, and we will do 1 second long breaths in 2 of them. So if we notice that the chest is not rising and that the breaths are not going in, we are going to assume that there is an obstructed airway. So we are going to gently, with our index finger, lift the chin of the infant, open their mouth, and look inside. If we see something lodged in their throat and their airway, we're going to use our pinky finger and do a swipe. A hooked sweep, I mean. After that, we're going to continue with our 30 compressions and 2 breaths. If the breaths continue to, if we continue not to see breaths, we're going to continue with our sweeping and our obstructed airway practice. If those breaths do go in, we can just continue with our CPR. And if we see our child start to breathe, then we will stop with our CPR, check for signs of life for no more than 10 seconds. And if there are no signs of life, continue CPR. However, if they do continue to breathe on their own, we will just monitor them and make sure that their airway stays clear until help arrives. So thank you for helping me save Baby Pillow today.